In 1912, the average life expectancy of the American female was 48 and a half years old. We never hit menopause. What helped menopause even become named was the increase in our quality and quantity of our life, improved lifestyle, things like safe anesthesia. People don't die from a ruptured appendix anymore or a ruptured gallbladder. They don't die from a heart attack. If we get to them in time, we can do open heart surgery or stents. We actually have done multiple medical breakthroughs, antibiotics. We can cure infection. So if we're allowed to make breakthroughs in all these other areas of health, why can't we make breakthroughs in menopause? Because women are living as many years without hormone from age 50 to age 80 as they did with hormone age 12 to age 50.
Welcome to the MINDTRX Podcast with breakthrough ideas to live your best life possible and how to make it happen. I'm Paul Scheele, and today we will be joined by Victoria Mondloch. Dr. Victoria J. Mondloch is a recently retired physician and was the medical director of Wisconsin Stem Cell LLC. With over 35 years of experience, she specialized in women's health, family medicine, and preventative health and wellness. Her approach was to educate and empower her patients to better understand their bodies and maintain healthy lifestyle habits. Dr. Mondloch specialized in bioidentical hormone counseling for women and men. Her books include Blossoming, Becoming a Woman, and Full Bloom, Perimenopause, Menopause, Postmenopause and Beyond. Hello, Dr. Vicki. So good to welcome you here to this MINDTRX Podcast. Thanks for being a part of it.
Oh, my pleasure. Thank you, Dr. Paul.
Well, it's a real pleasure to hear your backstory. We've had an opportunity to chat before, and I just love the way, as a medical student, you began to realize that Western medicine wasn't necessarily the be-all and end-all for human well-being. And I wonder if you'd be willing to tell that story about you being a surgical patient while going through medical school.
Oh, I was absolutely floored when, as a freshman medical student, going to class for 3 days with fever of 103 and a half and peritonitis, seeing the school doc, having him bring 5 different specialists in to see me, that I was the only one who kept bringing up the possibility, couldn't this be appendicitis? Oh, absolutely not. Each of the 5 would say, absolutely not. Now, this was pre-ultrasound, pre-CT scan, pre-MRI. So it truly was medicine the old-fashioned way, your physical exam and your history and rapport with the patient. So it was the 5th doctor who actually, on a pelvic exam, felt my appendiceal abscess and called it an ovarian cyst, that he was going to manually ovulate me. And so everyone knows that appendicitis is extremely painful. You curl up in a ball, and he starts mushing on my appendiceal abscess, and he ruptured it, and I was taken over to the hospital, getting ready for the operating room. And now the chief gynecologist for the whole medical school is going to be my savior and is going to open me up. So as they're wheeling me into the operating room, my husband is standing right by the gurney, and he says to me, "Do you have any questions?" And I said, "Yes, I do. Why do I have a fever of 103 and a half, and peritonitis, and my diagnosis is a twisted ovarian cyst? I'm only a freshman, right?" And he grabs my hand and he goes, now, dear, that's why I'm the staff and you're the student.
Oh, boy.
So literally, They open me with the wrong incision. I am temporarily closed, and the surgical team comes in to take over, and I die on the operating room table. I go flatline, and they have to bring me back. So, long story short, when I come to, there's a gentleman sitting at the end of my bed. Now, I have an NG tube, dual IVs, my surgical dressing still in place, and I'm coming out of anesthesia. And he straightens up and he goes, Victoria? Yes. What you I'm so and so from the medical college. And I'm thinking, oh, they came to check on me. And he goes, you realize you missed your exams. You realize that you could get kicked out of school. You realize that you have an incomplete until you finish, what you have missed and then pick up and take off from there. I said, excuse me? So there was absolutely no consideration for what just happened to me. The surgeon who opened me up never came back to my room to tell me what happened. The second surgeon literally told me what happened. And when I was back in medical school classes 9 days later,
Oui.
right? Because I had to be, I had been threatened that I'd be kicked out. I literally thought to myself, this is what medicine is. This is taking care of people with compassion. I almost quit. And I thought, no, you know what? Stay and be the change agent. So that's what I did.
So gorgeous. So were they able to discover that it wasn't appendicitis?
Well, that's why they had to call in the surgical team, because a gynecologist is not trained in how to take care of a ruptured appendix that had abscessed and then had also done its major damage to the rest of the abdomen.
Yeah, oh my goodness. My father had an appendicitis, and so did my 7-year-old son. So I'm a little familiar with it, but I just can't imagine there you're back in school after an intervention like that 9 days later. I'm so happy that you decided to become a change agent. That's great. Now, in your book, Full Bloom, which was written for perimenopause, menopausal, and postmenopausal women, you wrote something very important. You wrote, wrong answers can happen when the right questions were not even asked or addressed. You also talk about how the internet doesn't always deliver the information that we need, and that the wrong solution to a problem always becomes the next problem. And that speaks to a lot of times when we have symptoms, we don't know what they are, and we try to seek some help for them. How do you suggest that we navigate in a partnership with the traditional medical system that tends to be more authoritarian?
Well, and thank you for that question. As I outlined in my book, Full Bloom, it's all about the patient themselves recognizing what are their symptoms and understanding that symptoms may actually relate to low female hormone when it doesn't seem like it should. For instance, brain fog, short-term memory loss, increased acid reflux, muscle aches, joint aches, dry skin. So many symptoms that we would think, oh, acid reflux, increased reflux. I have to go to a gastroenterologist. Well, they only know how to scope you from above and below. And then they're only looking for polyps and cancer. So that has nothing to do with acid reflux, really. But they're going to start their conversation with you as, well, this could be cancer. They're trained to use that phrase. This could be cancer. So you get branded with this C right here that you can't get rid of. And now they've planted this fear in you that, oh my gosh, if I don't do those scopes, I could be letting my family down and having cancer. So you go through your, unnecessary testing to find out that everything's fine. And what it really was is check where your female hormone levels are and find out if it's relatable to hormone, because women in perimenopause have swinging hormone levels, and it's a very disturbing time when you realize 1 month to the next, your hormones may be at 85th percentile of normal, the next month at 15th percentile. And swings of that wild nature are going to manifest in more than just if you have a hot flash or a night sweat. It's going to manifest in every part of your body, because the question that you need to understand is which parts of our body have estradiol receptors. The answer is every single part of our body from head to toe.
So again, when somebody starts putting a brand on our forehead about what this might be, how do we advocate for ourselves? How do we get the kind of testing that would help us understand, oh, well, I've got a hormone imbalance going on here? Because it's not going to be a first move.
That's exactly right. And what I always, when patients would come into my office, they would say to me phrases like, you're the 8th doctor, you're the 12th doctor. I had one patient say, you are the 18th doctor that I've seen, and nobody has been able to help me. And I would look them right in the eye and I'd say, you're in the right place. So what I would start with is a hormone symptoms worksheet. And this is in my book. And this worksheet does address and put estrogen deprivation symptoms, again, those head to toe symptoms that you may not have any idea are relatable to low estradiol, low progesterone symptoms, and then excess testosterone symptoms. There are many on this sheet that you would have no clue relate to your hormone levels, much less that your hormone levels are swinging, because checking of your hormones is something that medicine does not teach its healthcare practitioners or doctors to do. So I'm, with your help, letting people know that this is a more comprehensive checklist than the North American Menopause Society's checklist. I'm telling you that this book, Full Bloom, is going to open your eyes as to the myths and the truths. It's going to give you a checklist. I'm going to go through the research. I'm going to actually give you multiple case studies. Women in their 40s, what do they experience? In their 50s, in their 60s, in their 70s and beyond. But the chapter at the end of the book is called How to Talk to Your Healthcare Provider.
Good. Well, it's a powerful and timely book for our aging society, I know. And I actually have been with a woman who is my wife since we were 19 years old. And now at age 69, we've seen a lot together. So I've watched all of the stages, most of the stages that a woman might go through. And I also have a daughter-in-law lives next door, and I also have a granddaughter who lives next door. So I've got 3 generations of women for whom your information is super important. And you have another book for younger women called Blossoming, which is more for the teenage, right? Adolescent and young adult women.
Correct. And it's written in the similar format that I just described, of looking at your symptoms and going through the research, dispelling myths and truths, how to talk to your doctor, case studies. But most important to remember is that the consented research that I did for 20 years helped me develop the curves of where age-appropriate female hormone levels need to be.
Excellent.
Because they only give you a reference range for age 12 to age 90. Well, wait a minute, that doesn't help anybody if they want to know, is my migraine headache tendency relatable to my hormone levels? Because I'm 16 years old. How come my best friend doesn't get migraines, but I do at age 16? And all they're given by their doctor is, well, we'll put you on the pill. Well, no, I want the answer. I want to know why. Medicine has lost the art of going to the root cause of why a symptom is happening, especially in women's health.
And especially in Western medicine.
Correct.
Quickly treat the symptom. And to this point, I would like to have you tell the story 30 years after an adolescent occurrence of rosacea. At age 45, the symptoms came back, and you were in medical practice as an OBGYN and a surgeon. And that set you on a new path to the kind of research that you're doing. Could you tell a little bit about that turning point in your life?
It was a Wednesday morning, and I remember.
At what time?
It was about 6:02. I woke up to get ready to go to the hospital. I had a full morning of surgeries lined up, rounds to make, and I woke up and my face felt like somebody had a blowtorch to it. And I went to open my eyes and I couldn't even open my eyes. And I had to literally take my fingers, like a little kid, and open your eyes. And I kind of padded my way to the bathroom and I turned on the light and I screamed because my face was beet red and swollen. I looked like I had done a binge drinking episode the night before. And so here I am with ice packs and cold water, just trying to get the swelling down. And I made it through the operating room, even with a mask on my face, because they had to keep putting ice packs between cases. And I got to the office, and my office manager looked at me and said, "What happened to you?" And I remembered being at a health fair and talking with an esthetician, and she said, "You have rosacea, don't you?" And I looked at her and I said, "Well, yes." She said, "When you're ready, come see me." And I thought, what an odd encounter. Well, I remembered that encounter very, very distinctly at that moment. So I had
because wouldn't you immediately think, well, this is an allergic response. This is something.
No, I had zero allergies to anything.
Okay.
And I knew it wasn't an allergic reaction. That would have been something more generalized, not my face.
Got
And
it.
even if it had been something food, it wouldn't, or facial product. I use the same facial products for the past 40 years. So I'm with my rosacea, very careful about what I used. In fact, I had been a medical director at a skin spa, a Medi Spa for 10 years. So I knew exactly what I was using and why. So no, I had no concerns about allergy, but I called this esthetician and she said, "Do you have time this afternoon?" I said, "I will make time." So I literally went to her office and she took one look at me and she said, "Your rosacea is acting up. What happened?" And I said, "I don't know." And she looked at me and she said, "Well, doc, if you don't know, how do you expect your patients to know?"
Ooh, good question, right?
Right? I went back to the office and I told my office manager that story, and she went, "Well, what are you going to do about it?" She's right.
Yeah.
So literally that began my journey of what is this whole perimenopause journey. There was minimal to nothing written. What is menopause? There was minimal written, nothing really in medical literature. And the research that was going on was just starting with Women's Health Initiative. Well, what I now know and outline in the book is there is a huge discrepancy between what American research looked at, Women's Health Initiative, and what European research looked at. How can two major approaches to the same question about are hormones safe in menopause? How can they come to opposite conclusions? What? The American research said women get off your hormone. It causes increase in breast cancer, increase in stroke, increase in heart attack. Yet the European research said, oh, no. It causes a decrease in breast cancer, decrease in heart attack, decrease in stroke, decrease and reversal of osteoporosis, and reversal of Alzheimer's.
Wow, wait, what? Okay, so
What?
so at that moment of a disorienting dilemma, what's going on with the research? What did you find?
The very interesting thing is that American research was all funded by the drug company that makes Premarin and Prempro. Most women have no idea what Premarin really comes from. Premarin stands for pregnant mare's urine. What?
Wait, what?
What? Pregnant horse pee? Right. And Prempro is Premarin plus a synthetic medroxyprogesterone acetate, the depot shot, the same class of artificial synthetic progesterone that goes into Mirena IUDs that actually are linked to an increased risk of breast cancer.
Oh, so that's the connection.
Right. So
So,
that's
but
the
what was,
American
okay, so what were they using then in Europe?
human-based bioidentical estradiol and progesterone, the same chemical formula, even though it was made by a pharmaceutical company, or it could be compounded, but still coming from something made, but the same exact chemical formula is what a woman's ovary makes. So
Okay.
human-based versus horse-based synthetic.
Aha.
Now, women are not horses. Thank you very much. I lost my tail a long time ago. And we are not test tubes. We are human biologic beings, and we deserve to have human-based biologically identical to the human body hormone put back into our body. Therein lies the difference.
All right. So the prescription to hormone replacement therapy has it changed since your work? What's happening now?
Well, most Western trained practitioners are only taught that they can, well, they start with Premarin and Prempro first,
Oi,
okay, because
oi,
that's what they learn in medical school.
oi.
Then there are some that are actually able to do and will write for low dose only, no checking of hormone levels, but just the lowest dose that we can give you for estradiol and progesterone, and that's all I can do for you, is what they'll say. This is what I can do. I can only do it to age 60, and then we have to stop. Well, wait a minute. You're not even doing the science of checking levels before and after starting a life-altering medication like hormone replacement. Nope, they just put them on the lowest dose and say, good luck.
Oh my goodness. Okay, so you came through your research to understand that there is a four-legged chair. We've got the female male hormones, we've got the thyroid hormones, we've got the adrenal hormones, and the insulin blood sugar hormone system. So you have to test. In your research, you say we have to test for all of those. Is that right?
Correct. And I want you to think about that concept of a four-legged chair as the four foundational legs of a chair. They are your pillars of optimal health. What that means is if you sit on a chair and one of those legs of that chair are broken, what happens? Boom, you're on the floor. You don't even know what just landed you on the floor. So you rewrite that chair and you sit back down on that same chair, and boom, you keep landing on the floor. Well, isn't that the definition of insanity? You keep doing the same thing and expecting a different result.
For
So
sure.
what happens in the body is we are not just thyroid and only check that, and that's all we have to check. That's what Western medicine thinks. It works all by itself. No, it works with the rest of the body. Adrenal, your stress organ. Oh, it works just with adrenal. There's nothing else we have to check. Well, no, it works on all of your body. People have known for decades that high stress jobs can cause premature heart attacks. And, executives from the 60s were dying left and right because of their high stress jobs. If people have an insulin issue, which never gets checked by Western medicine, they only check your blood sugar.
Glucose measures, right?
Right. So if all they're checking is a blood sugar and never asking you when you last ate or how long you fasted, there's no frame of reference as to how your pancreas is going to respond to that blood sugar. How did it get there? Drill to the root cause. And again, if a woman is in her 30s versus in her 40s, that's a completely different expectation, I have learned, for where their female hormones should be to be balanced, and women want to be women. They don't want to have more male than female. They want to be female. So what happens in menopause? We drop our female and the male takes over. So women in menopause become male. What?
So there's male dominant hormone signature within the body.
How do you think that impacts insulin? Negatively.
Huh?
How do you think that impacts thyroid? Stressfully. How do you think that impacts the whole balance of how your body works? Tremendously. Yet nobody tells you because nobody is doing menopausal research. Women's Health Initiative focusing on horse-based and synthetic hormone literally still carries this pallor of darkness over menopausal medicine that you can't go there.
So you're bringing up these common myths that you've had to encounter over the years. What are some of the more negative myths that we have to confront in order to break through that pallor of darkness that has fallen on female hormone?
Well, the first one that women get thrown at them is menopause is a natural event. I am not here to mess with Mother Nature. Okay.
Ooh.
Well, that sounds like, oh my gosh, there's nothing I can do then. Okay, I'm doomed. But I want to bring out the fact that in 1912, the average life expectancy of the American female was 48 and a half years old.
Oh.
We never hit menopause. It didn't exist. What helped menopause even become named was the increase in our quality and quantity of our life, improved lifestyle, things like safe anesthesia, where we could actually use other than alcohol to make somebody drunk, and then you could do surgery on them, even though they're screaming. They wouldn't remember it when they woke up. We now have safe anesthesia. People don't die from a ruptured appendix anymore or ruptured gallbladder. They don't die from a heart attack. If we get to them in time, we can do open heart surgery or stents. We actually have done multiple medical breakthroughs, antibiotics. We can cure infection. So if we're allowed to make breakthroughs in all these other areas of health, why can't we make breakthroughs? Because women are in menopause, because women are living as many years without hormone from age 50 to age 80 as they did with hormone age 12 to age 50.
Wow. Well, this reminds me of the work of a Dr. Susan Lark that I spent quite a bit of time with, and she was helping women with health issues because she had a terrible PMS issue when she was a young doctor at medical school. And very often, the treatments that were given for any of those symptoms just ended up circling back and creating more problems that then had to be treated, which created more problems that had to be treated. And it was the circle of inefficiency that ultimately didn't do anything. And very often, it's attributed to the woman as a character issue or a personality issue.
They're told many times, oh, your PMS, you have anxiety and depression. Well, wait a minute. Why do I have it 2 weeks out of a 4 week cycle? Why can I be perfectly fine for 2 weeks and then not be fine? Oh, well, that's just, you know, it's depressive and you're coming at it in a cyclic manner. They're completely talking around it without realizing that it could be hormonal. And it's actually on this symptoms worksheet. The first three symptoms are actually increased emotionality, increased moodiness, and increased crying. Those are all central nervous system symptoms from low progesterone. It doesn't mean you don't have any. It means that the amount of progesterone for the amount of estrogen you're making is out of balance. And so you do not have the appropriate amount of progesterone. And these women are summarily told they need to be on an antidepressant. Well, that's like saying to somebody, oh, you ran out of gas, AAA comes to your rescue and they put oil in your engine. See you, have a good day. Wait, I'm out of gas. No, we took care of you. Bye, see you. Well, that didn't take care of the problem. It solved AAA's problem. They came out and serviced you. We can prove on our record we serviced you. But wait a minute, that wasn't what I was asking for. And that's how women are treated. And so if only they knew that on day 21 of their cycle, when their progesterone peaks, is it where it should be, or is it lower and inadequate to cover their brain and central nervous system's needs for their emotionality and moodiness? And how can they therefore help that? They can add natural progesterone during that second 2 weeks of their cycle. And I've seen women go from literally almost catatonic, unable to do their job, staying home from work because they're afraid their boss is going to fire them, to vibrant, working, remembering their customers' names, being a house of fire like they are during the first 2 weeks of their cycle. We shouldn't have to endure what our bodies throw at us simply because medicine isn't smart enough to help us help ourselves through this phase of our womanhood.
Well, this is one of the beautiful things that you bring forward in your work. You talk about all these myths under which we're forced to live, and the fact that the system is rigged towards symptom and not cause causes a series of escalating error that can occur. So kind of in a summary of what we're talking about, Dr. Vicky, I'm wondering if you could speak to this idea that we are living in a human body, which is a biologic system, and we have to increase our understanding of this biologic system in order to be able to care for it. How do you recommend that we start that journey?
Well, realizing first and foremost that the body, like a symphony playing, if one instrument is out of tune, you hear it and it grates, even though there is an entire symphony of people up on the stage. You know when one instrument is out of tune. Well, your body does the same thing. And we're not just a physical, chemical body. We have a mind, we have a spirit, we have a soul. So we have to also balance our mind, body, spirit, because that is the essence of how we as a physical being can actually get through our day. But thank you for mentioning what else can we do, because again, Full Bloom is where I would tell every woman to start. Full Bloom is on Amazon. It is something that it is not written for your doctor to read. It's written for you, the female, to read. Hand it to your daughter, hand it to your husband to read, because he'll be absolutely blown away. Wow, this is what you've been dealing with? And the chapter at the end of the book, how to talk to your healthcare provider, gives you the ammunition and the words to use when you talk to them, because they'll try to dismiss you because they haven't been taught this. Well, you can use the hormone sheet from the book, mark it, give it to them as I'm putting you on notice. I have 10 things on this list, and we only have time to talk about 2 today, but I expect we're going to talk about all 10 because I want to know if they're related to hormone. Why can't we check my hormone levels? Bring the book with you. Wow, this doctor who wrote this book said this is the blood work I should get done. So if this is the blood work I should get done in this chapter called How to Talk to My Healthcare Provider, then this is why I want these labs done. And even if your doctor says to you, I can't code this correctly, you just said the ammunition that women need to use is medicine is symptom based. Every symptom has an ICD-10 code and can be used as that ICD-10 code to get your levels checked.
Okay, so tell me what ICD-10 is.
It's the International Code of Diagnoses or something along that line.
Got it.
But
yeah.
it is the Bible that every doctor insurance company uses to say whether or not they're going to cover this blood test.
Got it.
Ordered, right? So under annual labs, your hormone groups will not be covered because they're not considered essential annual labs.
Right.
So they will have to fall under a diagnosis set of codes, which that's what you've just given him are the diagnoses. Okay.
Nice.
Right.
Nice. So, and if you still get kickback, find another doctor.
Bingo. Then, realize too that independent docs can do this for you without, even batting an eyelash. If you are going to a system doc who works for an organization, a hospital, or an insurance company, they are told you can't go there because this doesn't make the system profitable to chase down these roads. That's wasting money, and we can't let you waste money. You have a quota to fill. You have to, as the primary care doc, your job is triage, and you have to see the patient and then decide how many referrals. Well, if you have 10 things marked on here, then that doc in primary care is going, oh boy, 10 referrals. I'm going to make my quota this month. Well, what happens to you as the patient? You're sent to 10 different specialists.
None of whom are talking with each other, right?
Right. And none of them know anything about how they all tie together with hormone deprivation or perimenopause or menopause.
Well, I want to do a little shout out as well to the men who are listening, because no doubt there are women in your life that need to know about this. And for my own personal journey, I was referred to a urologist for, abnormal sense with a digital rectal exam during my primary care physician. And I was sent with a very low prostate antigen count of 0.6. And I went to the referral and he said, why are we meeting? I said, well, I was told to come see you. Don't just go away until it's 4.0. Well, I had a cancer that was so aggressive it switched off the prostate's ability to produce the antigen. And 5 to 8 years later, I could have been in the same situation that a friend of mine is in who just passed away from stage 4 prostate cancer that was never diagnosed. I was a zebra in a herd of horses, and often we are being treated as a herd, one of a statistic and not a unique individual. So what you're talking about is advocating to get to the cause.
Right, right. And realize women are not the zebra. We're the herd already. So
Yes.
why are we being ignored as the herd? We should be heard. be listened to and not summarily dismissed simply because the medical system doesn't understand. They shut off the research to good women's health years ago when the Women's Health Initiative embarrassed their researchers by saying, oh no, hormone didn't cause a decrease, it caused an increase in all of these factors we were looking at: breast cancer, heart disease, and stroke. Yet when they saw what the European research showed, they actually went back and repeated some of the European research. And guess what? American researchers found the same answers, that it decreased all of those things. But shh, we can't say anything out loud because that would make the first set of researchers look bad. And we'd have to change the whole paradigm of how we treat women's health in this country. Well, no, just it's better off to just not say anything.
Oh my.
Women are resilient.
Oh my. Well, I do have to say that being on the leading edge of a shift in a paradigm, of shift in a way of thinking, is never an easy job. And yet you've stayed with it. You retired from the regular practice of medicine and you continue to this day doing this work. Thank you so much for it. Is there any final message of encouragement you'd like to leave with all of us?
I want to say, women, take back your power.
Nice.
Learn how your body works. Trust that your symptoms you're having are real. They're not depression. They're not something your doctor wants to change your symptoms into a completely different diagnosis, put you on medicines that don't work, and then try a second medicine. Oh, you have side effects to that. We'll put you on a new medicine. It becomes a drug mill. You keep getting put on more and more and more and feeling less and less well. So trust your body and be your own advocate.
Beautiful. Perfect. Thank you so much, Dr. Vicki. It is a delight, as it was before when we first met. Thank you so much for the good work you're doing in the world.
Well, thank you for the opportunity to have this ability to speak with you. I really appreciate that.
Peace and blessings. I hope you enjoyed our conversation with Victoria Mondloch. You can learn more about Victoria at www.drvictoriajmondloch.com. And now in the second part of the podcast, it's just you and me. I'll tell you how to use the Paraliminals sessions in the MINDTRX app to easily handle obstacles and move toward the success you want, especially as it relates to Victoria's messages. If you're new to the relaxing Paraliminal audio sessions, they use breakthrough technologies to activate your whole mind in only 20 minutes to help improve any area of your life. Let's get going. Hi, and welcome back. This is our opportunity to dig a little bit deeper into the conversation I had with Dr. Victoria Mondloch. Dr. Vicki's approach to taking charge of our personal health speaks mainly to women, but also to men and women alike. We need to be able to be advocates for our own well-being, to recognize that we're a complex biological system and that simple answers of just addressing symptoms when they appear might not be enough to really lead to the ideal health and balance that we would like to have in our lives. So in looking at the Paraliminals that can help us in this journey, there were 5 areas that I felt might be able to take a look a bit more deeply. The first is taking charge of your own health. The second is about finding balance in life. The third, being a self-advocate in the healthcare system. Next is increasing your self-understanding. And finally, finding answers to challenging questions when they emerge. All right, so let's look at this first area, taking charge of our own health. The paraliminals that can help us quite a lot in this, number one, perfect health. Because what it does is it helps us tune into our own physical body and identify areas that may be problematic, and using the mind to actually shift how we envision or work with the systems within our body. Very helpful. Great to do anytime you feel a symptom coming on, but also just on a regular basis to recognize that who you are as an intelligence inhabiting this physical body, you can be an advocate and actually help out. Second is recover and re-energize. We're using our body all the time, and sometimes we put a significant amount of stress on it when we do to actually gain the benefit of that stressful pressure we put on the physical body to actually gain greater agility, strength, resilience. The recover and re-energize paraliminal, super helpful. A third paraliminal that can help quite a lot is called power thinking. So when we're talking about taking charge of our own health, really taking charge of anything in our lives, we want to be able to focus our mind on the outcome that we're attempting to create. And sometimes there will be some challenges that we have to face. Power thinking gives us the ability to laser focus our thought process, and our thoughts then become a power in and of themselves to break through to the next level that we're seeking. So those are the three for taking charge of our own health: perfect health, recover and re-energize, and power thinking. The second area is about finding balance. Now, it may be a work-life balance. It might be balancing some of your priorities in any area of your life. The idea of finding balance is a tricky one. If you think about balance as being a final state, it doesn't really happen. If I take a tennis ball and throw it up into the air, when it's no longer traveling up and it hasn't yet started traveling down, there's this moment called equilibrium, what we might call balance, where all of the forces on that tennis ball are absolutely the same. But it's the most fleeting experience in the universe. Equilibrium isn't something you attain and then you got it. It's an ongoing system of movement and change and development. And it means that you need to put energy into it. So one way in which we can do that is with a paraliminal called 5 Elements Healing, where you actually work with the organ systems and the way in which you communicate with that to balance the energy systems within you. The second one is an interesting choice. You deserve it. Think about it. How often are you giving, doing for everybody else, but not for yourself? So if you're going to find balance, you have to first be a person who recognizes that you deserve some attention here. It's especially important when we're dealing with symptoms or we need an additional level of care. Many people will say, oh, I don't want to bother you. I don't want to put you out. Hey, you deserve it. So finding balance, 5-element healing, and you deserve it. The third area is about being a self-advocate in the healthcare system. Are you treated as just another person in a group of statistics, or are you going to be unique in terms of how you are addressed with your own personal needs, your own personal systems, and your own personal issues? Can you get the attention of others? First of all, I think active listening helps a lot. So you can be patient and make sure that you hear what it is that's being communicated to you by the healthcare system. And then to advocate for yourself is talking to win. be sure that you can communicate your unique needs. And as Dr. Vicky suggested, have a piece of paper that you can point to and say, all of these, I want the tests that will help me out. You have to be your own best advocate. Otherwise, the system is going to treat you like another one of a zillion that they see on an ongoing basis. Pretty interesting. Active listening, talking to win. The fourth area is about increasing your self-understanding. Now, honestly, the concept of know thyself has been essential in the human family all through human history. It's important that we come to a better understanding of who we are. And hey, the more you read, the more you study, the more you discover. And it is important to be a lifelong learner, especially when it comes to our own health and well-being. Now, one of the Paraliminals that can help us with that is called the Self-Esteem Supercharger. Self-esteem is the way you esteem or love yourself, not because of what you do, but just because of who you are. Self-Esteem Supercharger will help up-level your ability to take the time to study and understand the real magnificence that is who you are. Another paraliminal that's helpful in getting to a higher level of understanding of who we are is called personal genius. I can't tell you how many people I know that if they ask a question and suddenly an answer comes back to them, they go, oh, this is over my head. I can't deal with this. I don't know anything about it. I don't know how I'm going. Stop it. Just because it's new, it doesn't mean that you can't learn it. And it's essential that you do learn to make new distinctions. So listen to the personal genius. And what you're going to discover is you can learn anything if you put your mind to it. So quit talking about any disabilities that you have in learning and take the time, be patient. Now, it's also really helpful when the person that you're reading or studying from is open to getting questions or is open to clarifying something that you don't know. I remember going to college and I didn't understand organic chemistry, and I kept going to these classes. I kept getting more and more lost. And I went to the professor of the organic chemistry program and asked some questions. And he said, why are you asking me this? Because you're my professor and I don't understand what you're teaching. Well, you shouldn't be talking to me. You should go talk with a teaching assistant. Okay, I mean, I was a student and the all-powerful professor seemed to be the one who wasn't going to be willing to work with me. All right, so I need to increase my understanding. I pursued it through some other channels, right? But I wasn't willing to lie down and take bad grades because I didn't follow how it was being taught to me. And you know, the one thing that was never explained, how do you read a textbook in organic chemistry? I mean, I would sit down in the library, it'd take me hours to read a single chapter. I'd be falling asleep, not getting it, doing terribly with it. Finally, when it came to answering the questions, I'd be all active, I'd be in it. I really enjoyed it. The thing was, nobody ever showed me how to learn. So learning how to learn is critical. Now, if you read my Natural Brilliance book, or if you read Photo Reading, that's going to be really helpful as well. The idea of personal genius is you can do it. It's like the Self-Esteem Supercharger for you as a learner. Super helpful for increasing your self-understanding. Self-Esteem Supercharger, personal genius. And the final area I'd like to talk about is finding answers to challenging questions. Well, the paraliminal that I did with JJ Virgin when her son was in a catastrophic hit and run accident and left basically brain dead, she wasn't willing to accept that. So she advocated for him and pushed all of the systems in order to get answers that she needed. And we track that through 7 different ways in which you can develop your own miracle mindset. Don't give up on anything that seems to be problematic for you. Keep on learning. Keep on finding answers to the questions that aren't being addressed. Miracle mindset. The other one that's very helpful, paraliminal, that's very helpful, is intuition amplifier. You see, there's a lot of noise out in the world. And there is a signal of wisdom that's coming through us. We need to boost that signal and reduce the noise. So the signal to noise ratio shifts in favor of getting a clear, intuitive signal that can come through and guide you on the next step in your journey. Super helpful and built in to this idea of finding important answers. Now, there could be a lot of other paraliminals I'd recommend, but these are good ones to start with. I hope you enjoy the podcast. I really loved getting to know more of what Dr. Vicky's work was all about. I loved reading her book, and it was for women. I live with women. I love women. My daughter-in-law, my granddaughter, my wife. How many people that I know whose lives I'm impacting and who are impacting my life. So, beautiful book, beautiful work. Do get into it. Thanks so much for being a part of this podcast, and I hope to see you again real soon. Bye for now. Thank you for joining me today. I applaud your willingness to maximize your potential. You can easily use the Paraliminal audio sessions in the MINDTRX app to stimulate your non-conscious mind, that is your inner mind, to reduce any resistance in your life and to propel you toward the success you want. Go to www.mindtrax.com/go. These amazing audio tools have helped millions, and I encourage you to bring them into your world today. Be sure to be back for more episodes of the MINDTRX podcast. You'll find insightful conversations with authors, experts, and thought leaders, all devoted to improving your life's experience. Thank you again for being here on our MINDTRX podcast.